Hi, I'm Joanne Majors.
And I'm Kathy Signo.
And we are here with you today to talk a little bit about a blog post that I recently wrote that created a little bit of question for some people and stimulated some interesting conversation. We have just come from we were in the studio this weekend.
Yes.
Shooting new implant training videos. And one of the things that came up is I do a lot of stuff that's savvy lingo. I actually have slides and have had for probably 15 years that say this, not that. And now I'm into this. I am going to talk about this. I'm not going to talk about this because I'm not going to talk about the different types of bone material that they can use for a socket graft. I am going to talk about why the team should be able to preheat that treatment. So one of the things that came up was this, one of Chuck's favorites and one of mine is that dentures are not a replacement for your teeth.
Yes.
So it's interesting. People, when you first say that, people are like, what do you mean? And so the way we use it is we say dentures are not a replacement for your teeth. They're a replacement for no teeth. Your teeth have roots. Dentures do not have roots. That's what we're talking about. The man-made root, which is the implant that replaces your natural root, and then man-made teeth on top of them. It's a concept, though, when you say to a patient, well, I know that you say you want to go ahead and get those out and get dentures. Great. I hear what you're saying, and I'm happy to talk to you about that, but I need you to understand that dentures are a replacement for no teeth. They're not a replacement for your teeth. You have teeth. So if we talk about replacing what you have in your mouth, we've got to talk about, implant therapy. So when you've used this, you guys came through the seminar, you have implemented most of this in your practice, and you revisit it. What's the thing for this that resonates for you when you guys are talking to a patient?
Well, the thing that when we talk about our team and training, we always say that you need to use words that paint a picture.
Yeah.
People are visual. 65% of learning is visual. So you need to paint a picture that patients can understand.
Yeah.
Look for an analogy that fits for them.
Yeah.
And that's the way we look at this, is because we're painting a picture for them. When you say it's a replacement for no teeth, now they're thinking about gums.
That's exactly right.
They're thinking about, these aren't going to chew like your teeth.
That's exactly right. And it's interesting that you say that because this is bedrock to what I've taught for 2 decades and more, much more. Don't tell anybody. This is bedrock to that. I say, listen to my thoughts and not my words. There are very few things that I will ever say, this is how you say this. And when I do, write it down because that's how you say it. It's like for our cancellation system, there's only one question. You do not deviate from the question. You use that question and you'll have the result you want. What was interesting that I just heard you say is you say, we tell them about paint the picture. What did you say?
Yeah, you use your words to paint a picture.
Okay, and I say all the time, okay, I'm going to give you word pictures. So I say word pictures, you say use this to paint a picture. So the point is, this is what's really good about a system. This is a skill that works, but you've got to put your systems around it to support your team to use the skills.
Yes. And it has to be personal. People can tell if you're authentic or not. You don't have to sound like me. You don't have to sound like Joanne.
Please
don't.
You
have to sound like authentically you.
Yeah.
So people feel that.
Yeah.
They know if you care.
Yeah.
They know if you're authentic.
Yeah.
So I always say there's a message you have to deliver, but how you deliver it comes from the heart.
That's exactly right. And I think the thing that is really critical to us when we decided to shoot some of these short videos, because we had more and more people saying, I don't know about an online learning, but can you give us more? And I'm from the school of my mentors, Joy Millis, Naomi Rohde, Linda Miles. All of the mentors I had said, give your best stuff away, they'll come back. So we decided we'd start putting a short video with some of these blogs so that you could understand. We really, Kathy is still in their practice. Not as much as she was because we're doing some other things.
Right.
I'm still in the practice. Not as much as I was, but I'm still doing other things. And even as recently as last week, there was a consult there that they had already said the person didn't have money, and we went through this whole thing. And at the end of the 2-hour consult, which Chuck wasn't in there the whole time, the doctor can't afford to be, but that's the reason we believe that the team needs to know these skills. But what was interesting is we walked up front and the lady said, gosh, after learning all this, and the husband said, after all we know now, how can we have her have those 4 teeth taken out unless we can plan for how we're going to put that root back? And so for us, we had succeeded. Now, I don't know what that looks like, but I just know that my job is to give them the information the way that they can understand it.
Yes.
Then they can make the decision. And team members, if you are listening to this, you have to understand your role in this is more valuable than it's ever been, because nobody really cares as much about what the fat cat doctor says as they do when that doctor walks out of that room and they turn to you and they say, what would you do, Kathy?
Yes.
Because that's the reason we're committed to doing some of these short videos, so that you understand with the soft skills training we do, this is what we're talking about. It is a behavior, it's an attitude, and that's the only way. The girls said to me, I don't know how I'll ever be able to do that with this patient like you did last week. I said, you will when you absolutely believe it. Because if you believe it, it's easier to share. And I say, do you believe that Dr. Majors is amazing? They said, yes. I said, then that's where you start.
Yes.
So I think that's the takeaway on this. But dentures are a replacement for no teeth. They're not a replacement for your teeth. So share the truth with your patients in the way that they can understand it, and I think we'll all be better served. So I look forward to seeing you on the road.